and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. Losing sleep over love is something everybody wants to experience. But what if losing sleep or not getting enough sleep becomes a regular feature? Sleep deprivation or insomnia happens when you are not sleeping as you should. That can mean that you're not sleeping enough, you are not sleeping well, or you're having trouble falling or staying asleep. It can lead to various physical and mental health problems, including impaired cognitive functions, weakened immunity, and increased risk of chronic diseases. For some people, insomnia is a major inconvenience, but for others, it can be a major disruption as well. The reasons why insomnia happens can vary just as widely. Today in Wellness Watch, we discuss insomnia and the importance of good sleep. I'm Preeti Kaur. Sleep, a natural process often taken for granted, has silently become a major health crisis in today's fast-paced world. As work pressures rise, screens stay lit into the night, and stress becomes a constant companion, more and more people are finding themselves battling insomnia. But what exactly is insomnia and why is it affecting such a wide range of people? Let's take a look at this special report by DD India's Harshita Oberoi.
Insomnia, the silent thief of rest. It is a common sleep disorder that makes it hard to fall asleep, stay asleep, or wake up feeling refreshed. It's not just about tossing and turning, it's about facing every day drained, unfocused, and anxious. Symptoms include trouble falling asleep, frequent awakenings, waking too early, and feeling fatigued during the day. Irritability, poor concentration, and persistent worries about sleep are common red flags. There are two major types of insomnia. Acute insomnia, which lasts for a few nights to a few weeks, often triggered by stress or life changes. And chronic insomnia, which lingers for 3 nights a week or more, lasting for months. Now, what causes it? The culprits are many: stress, anxiety, depression, poor lifestyle habits, other sleep disorders like sleep apnea, and stimulants like caffeine or tobacco. Even your environment, like noise or poor bedding, can trigger it. Insomnia does not discriminate by age. In fact, it becomes more common with aging. Older adults often experience changes in sleep patterns, lower activity levels, increased nighttime urination, and higher dependency on medication, all of which interfere with sleep. Certain groups face greater risk. Women dealing with hormonal changes, older adults, those with mental or physical health issues, higher stressed individuals, and those with irregular routines like shift workers or frequent travelers. And what is the cost? It's steep. Insomnia lowers work and academic performance, slows reflexes, increases accident risk, and raises chances of chronic illnesses like hypertension and heart disease. It also fuels mental health conditions such as depression and anxiety. Yet, insomnia is preventable. Sticking to a sleep schedule, staying physically active, avoiding caffeine and alcohol, and limiting naps can all make a difference. Your bedroom should be a sanctuary for rest, dark, quiet, and cool. Diagnosing insomnia may involve physical exams, blood tests, sleep diaries, and even overnight sleep studies if another sleep disorder is suspected. Treating insomnia can involve cognitive behavioral therapy for insomnia, which helps address the thoughts and habits disrupting sleep. Medications may be used, but lifestyle changes often have the most lasting impact. But what happens when we sleep late, night after night? Immediate problems include grogginess, reduced alertness, memory lapses, and lower workplace productivity. Long term, increased risk of diabetes, heart disease, and even depression. That's why lifestyle and home remedies matter. Setting a routine, cutting down stimulants, staying active, and keeping a peaceful bedtime ritual. A warm bath, light reading, or soft music can help the body wind down naturally. Some turn to alternative practices like yoga, tai chi, and meditation. While evidence is limited, many find comfort in these ancient arts to calm the mind and restore balance. Insomnia is more than a sleep issue. It's a health emergency in slow motion. If left unaddressed, its effects ripple through every corner of life. The message is clear: sleep is not a luxury, it is a necessity. Prioritize it, protect it, and seek help when needed. Because in the end, a good night's sleep may just be the best medicine. Harshita Oberoi reporting for Wellness Watch DD India.
All right, so insomnia is when you experience disruption in how you feel or function because you're not sleeping well or sleeping enough. About 10% of the world's population experiences insomnia that qualifies as a medical condition. It is usually not dangerous, but there are many ways, including medications and mental health options, to treat it. How much sleep is enough varies from person to person, but most adults need 7 to 9 hours of sleep a night. Today in Wellness Watch, we look for answers to these questions. What is insomnia? What are the types of insomnia? How is it diagnosed? How common is insomnia? And what medical treatments are available in India? All right, insomnia treatment in India typically involves a combination of lifestyle changes, therapies, and in some cases, medication. Our primary focus is on establishing good sleep hygiene, including regular sleep schedules, a relaxing bedtime routine, and avoiding stimulants before bed. Cognitive behavioral therapy for insomnia, that is CBTI, is a common therapy used to address negative thoughts and behaviors that contribute to insomnia. Up on your screens, we'll get you some hospitals and institutes in the country that particularly deal with this. All India Institute of Medical Sciences, Delhi; Sir Gangaram Hospital, Delhi; Comprehensive Center for Sleep Disorders, Trivandrum; Ram Manohar Lohia Hospital, Delhi. All right, to help us understand sleep disorders better and what is insomnia, we are joined by guests in the studio today afternoon. We're joined by Dr. Karan Madan, Professor, Department of Pulmonary, Critical Care and Sleep Medicine, AIIMS, New Delhi. We're also joined by Dr. G.C. Khilnani, Chairman, Pushpawati Singhania Research Institute of Pulmonary, Critical Care and Sleep Medicine, Delhi. He is also the former professor and HOD, Pulmonary Medicine and Sleep Disorders, AIIMS, Delhi. Welcome both of you this afternoon on Wellness Watch. We've shown a detailed report to our viewers talking of insomnia. Dr. Khilnani, to begin with, though our viewers have got a pretty good idea of what insomnia is, but to begin with, I would want you to explain to us why is good sleep important for our overall good health.
So, Preeti, firstly, my opening remark will be that over a period of 100 years, the average sleep of all of adults have gone down by 1.5 hours. And there are reasons for it that we'll discuss. But sleep is important not only for human beings, for animals also, because it rejuvenates our body, our mind, and also enhances our immunity. And if you put it other way around, the sleep deficiency will lead to immediate unwellness in form of reduced cognitive function, that is our intelligence or whatever you may call it. It will also lead to our lack of performance, but also as shown in the picture that it leads to several diseases. In fact, there were 20% increase in the heart attacks in one study conducted in the United States, over 500,000 individuals. Diabetes, hypertension, strokes, variety of cancers, they are all enhanced because of the sleep deficiency. So it is very important for everybody to sleep for a sufficient period of time, and that sufficiency will vary from person to person. It's not that everybody needs 9 hours of sleep or 8 hours of sleep. Somebody system is good for 6 hours of sleep, but we have killed our sleep because of our lifestyle that we'll be discussing.
Yes, all right. I'll take that forward to Dr. Madan. Dr. Madan, Sir talked of lifestyle. Now, we are leading such lifestyles where we are battling stress, anxiety on a daily basis, everyday basis. Lack of sleep can also be attributed to work pressures, can also be attributed to various, connected to day-to-day lives. When is it that a person should consider that his lack of sleep is somewhat progressing towards insomnia?
Yeah, so I think as was discussed, the duration of sleep, varies across the spectrum of age. So see, it's a young baby would sleep for like 14 to 17 hours, but an average sleep for an adult is usually between 7 to 9 hours. Now there are genetically some people who do well with smaller duration of sleep. For some, they would be sleeping for say 6 hours, even a little less, but they would be feeling okay. The problem happens is when the lack of sleep leads to effects which hamper your ability to function as a normal individual. By that I would mean, if you have difficulty in concentrating, you are irritable, you are facing mood changes, you are constantly feeling sleepy during the day, and it is kind of affecting whatever you are meant to deliver as an individual, depending on the work you have or the kind of activities you are engaged in. Now this also varies, the kind of sleep people get also varies depending on the kind of jobs they are in. Say for people who are in armed forces, who are in military or combat workers, they have a tendency to be light sleepers. That is okay for them. But there are some people who have a stronger sleep. There are some people who are like early birds. So that is like they will sleep early, wake early. There are some who are kind of a night owl phenomenon. They will sleep late, wake up late. But at the end, they are able to function well for whatever they are about to do. When you feel that your functioning is being impaired, you are feeling that there is something wrong, that is when you should consider that this lack of sleep is becoming problematic and you need to seek some remedy for that.
All right, Dr. Khilnani, what types of insomnia are there?
So, defining...
Are there different stages also?
Yeah, defining insomnia, that is one thing, that there is nobody who doesn't have lack of sleep for some reason or the other. And suppose somebody is not sleeping 7 days a week, well, once in a week, or it is altered, it really doesn't matter. When the sleep is disturbed 3 times a week, by definition it is called insomnia, and when it is there, similar thing is there for 3 months period, then it is called chronic insomnia. Now there are, the insomnia is of 3 types. One is then when one is not able to go to sleep, when he goes to bed, 1 hour pass, 1.5 hours pass, 2 hours pass, he is unable to go to sleep. Second type is that in between his sleep is broken, and then he is unable to go back to sleep. And third type is that even in 3-4 hours time, his sleep is finished, he wakes up, and even if he wants to go back to sleep, he is not able to sleep. So his sleep time is reduced. But there is something more. Some people who sleep for 8 hours, but still their sleep is unrefreshing. That is because of a disease called obstructive sleep apnea, which is extremely common. I mean, you can say 14% of males and 5% of females in India have sleep apnea. They sleep for 8 hours, they snore, but at their subconscious level, their sleep is disturbed. This is what is called as fragmentation of sleep. So they also behave the same way. Their sleep is unrefreshing, they wake up groggy. The daytime they tend to sleep every now and then, and I am sure everybody has witnessed such things. So insomnia is a very big problem, and I have already described the types, and we will discuss the remedies for that.
Dr. Madan, what is the difference between a sleep disorder and say a few nights of bad sleep? Are both of them same?
So not really. So I think a few, so if you see the statistics, nearly 1/3 of individuals, I would say everyone, may experience some degree of sleep disruption some point of time in their lives. But as you mentioned, insomnia as a medical disorder would be like nearly 10% of the people. Now once we mean that, the symptoms are the same that what I discussed earlier, that once you feel that those things or those symptoms are affecting your day-to-day living. So then that is the time when you term that this insomnia is like a medical disorder, or you term it like insomnia as a medical condition. Regarding the sleep disorder, so a disruption of sleep just by itself, you are not able to sleep, is termed as insomnia. But as Professor Khilnani sir also mentioned, that once it's a breathing related issue which is leading to sleep problem, that is called as sleep disordered breathing. That is itself another condition That is an insomnia which is secondarily due to some problem which an individual has. So that is usually a condition that when they usually go to sleep at night, their airways tend to get narrow and they are not able to breathe well. So this condition in which a breathing problem leads to lack of sleep is called as sleep disordered breathing, of which most common cause is sleep apnea, and that is a different medical condition which requires evaluation and treatment separately.
Right. Dr. Khilnani, how is insomnia diagnosed?
So insomnia is diagnosed by the patient himself. You know, he complains that he is
Yes.
unable to sleep. It's a very serious issue, because if somebody is not going to bed and not able, he is tossing and turning in bed, or he wakes up in the middle of and the incidence of insomnia is staggering 10 to 30% in the world population. It is increasing. Now, one thing which we have not discussed, we must discuss is when the insomnia is because of the physical condition. Somebody has pain or somebody has breathlessness, that is different. The insomnia could also be because of psychiatric disturbances like depression and anxiety, that is different. What we are talking about, a person who is normal but is not able to sleep. So he will, it manifests in two ways. One, that patient is complaining that he is unable to sleep when there is true insomnia, and if there is a sleep disordered breathing or any other sleep related breathing disorders, then he wakes up groggy. You know, the symptoms are that in the night he keeps waking up with a dryness of mouth, and after sleeping he wakes up groggy, he needs a cup of coffee, one coffee, two coffee, then he doesn't feel like getting out of the bed, then he goes to work, in the car he sleeps, driving becomes difficult, he is sitting in the meeting, and whenever there is something which doesn't require his active intervention, he tends to doze off. In United States, from where the majority of data comes, the commonest cause of car crashes is sleep apnea. There was an interesting study done where 28 hours of sleep deprivation led to the cognitive dysfunction which was equal to alcohol intake, which is prohibitive for driving. So their problem solving capacity severely goes down.
So this is grave.
This is grave.
Yes, but Dr. Madan, I'll take that forward to you. Are people really aware of this? Because in today's fast-paced lives, we have people, you know, who after hectic days, they want to spend time, you know, during their bedtime, they want to sacrifice the bedtime and they want to watch, you know, binge watch, or for that matter, scroll their phones, which is called revenge bedtime procrastination. Are people really aware of this syndrome? Are people really aware of what they're sacrificing? One. And secondly, again, what is the extent of awareness in people with regard to these sleep disorders in today's times?
So I think awareness as such, I think in my opinion, is lacking. And also there is a lack, or I would say, a disregard of people to appreciate this as a medical problem, as a problem as a whole. So I think if you see, we also are, man is we are a social, at the end we are also animals, in the sense that nature has made a day or night cycle which is to be respected. I mean, if the night or the evening period sets in, there is a way that the lights dim out, an atmosphere is like, once there is an atmosphere where the body needs to wind down and sleep. The problem is that in today's fast-paced world, the emergence of technology, screens which have emerged as a big problem over the last, I would say, 10 to 15 years. If you see 20 years back, screens or screen time was not a major problem. But now screen and various forms of screen has exploded. The screen or the light exposure which we get at the time when we are meant to sleep is profound. You have tablets, you have phones, you have LED, LCD screens, you have ambient lighting which is so bright. These are things which are not normal. And evening time is like your light should be dimmed down, the whole ambient lighting, your screen exposure, these things have to be cut down. People don't appreciate that. You cannot expect your body to be watching a screen and next expecting your body that now I am done with my screen and now next moment I should sleep. So I think once we talk about sleep hygiene per se, a very important component of sleep hygiene is respecting a ritual of sleep. You should have a consistent time of waking up and going to bed. Once you are about to sleep, there is also called a winding down period. Let's say an hour before that, you create an environment which creates an atmosphere that you are about to sleep. That
For the benefit of our viewers,
Yes.
I would want you to explain to us what is this environment,
Yes.
because again, it is very difficult for a person to, put the screen aside and, get ready to sleep. For the benefit of our
Yes.
viewers, help us understand how do we prepare to sleep.
Yes, so you should have a sleep time which is fixed. You should have that this is my sleep time, that this time I will go to bed. Now, if you say you decide your time for sleeping is 10 p.m. or say 11 p.m., an hour or so before that is a winding down period. Once you reduce your exposure to sound, reduce your exposure to light, reduce your exposure to sleep, to screens, and also avoid heavy meals before an hour or so before sleeping. A heavy stomach, you have a heavy meal, it leads to reflux. You lie down after taking a heavy meal, you'll have regurgitation. So these are small things which we don't appreciate. So I think having these, avoiding tea, coffee, so I think these are, so I think if you have a sleep time when you have to sleep, the preparation for sleeping should start an hour or 1.5 hours before that.
Yes, sir, you want to add?
So I would like to add what Professor Karan has said, that there has to be a what we call in Hindi dincharya. You have to follow a routine. One thing that after 5 o'clock one should avoid taking tea and coffee. Those who think that alcohol is good for sleep, they are sadly mistaken. Alcohol induces sleep, but the quality of sleep is poor. Your dinner should finish 3 hours before your scheduled bedtime. Besides that, youngsters, they do go for exercise. There should be no vigorous exercise 2 hours. You shouldn't decide to go to gym at 11 o'clock in the night and then sleep at 12 o'clock. And those who have difficulty in sleeping, and of course you should not see any WhatsApp and respond at that time 1 hour before. Besides that, if you have little difficulty in sleeping, then reading book is always helps. Another thing is that there is nobody who doesn't have a disturbed sleep because of whatever reason. If you are unable to go to sleep for say 20 to 30 minutes after hitting the bed, don't get perturbed. I'm not able to sleep. That itself creates a sort of a self-induced insomnia.
Okay.
So what you should do, your sleep is going nowhere. It will come to you. You get up, don't look at your mobile phone. We all do that, but it must not be done. You start reading something, take a small stroll, go back to sleep, it will come to you. If you have difficulty in sleeping on a regular basis, it is good to have a warm shower just before going to bed. And if you are a little hungry, you can consider having milk or fruits.
Right.
And as Dr. Karan said, having butter chicken and chana bhatura just before going to bed is detrimental to your
Alright, so
sleep.
these are the healthy precautions which one can take to ensure a good night's sleep. Very quickly, I would want both of you to tell us what medical treatments or what medical advancements have been made in this field. Very briefly.
So medical advancement number one that everyone knows about, and this program is also part of it. People are aware that sleep is important. They are getting more and more aware. What we have not talked about is those who do night duties like doctors and nurses and people working in railways or drivers and shift workers. The total days allowed for shift work, night duties is not more than 7 days. As far as the management is concerned, first is sleep hygiene. Those who have true insomnia are unable to sleep. Of course, there are medications, but all the medications of sleep apnea, insomnia are habit forming, and I am aware of my patients who are taking sleeping pill for 15 years, 20 years. That is detrimental. It should be understood that the sleep that you achieve by taking tablets is not comparable to normal sleep. The sleep, that quality is extremely poor.
Right.
And if in that case, you should consult a specialist.
Dr. Madan, do herbs and supplements also help in insomnia?
So I don't think that we have a clear answer to this thing. I mean, regarding a healthy lifestyle schedule, means having a healthy routine, having an exercise schedule, and having a balanced, healthy diet. That is what is important.
Right.
But I think just by saying that you'll pop in some supplement or a herb and you don't care of your sleep hygiene and your overall schedule and expect that you'll sleep well, that is a myth.
All right, that is a myth. That brings me to this next
something
one.
I would
Yes.
like to add about melatonin. In United States, it's over-the-counter drug. Anybody can go and buy. And in India also, people are gulping it like chocolate. They want to sleep.
They'll be right.
What is melatonin? Melatonin is normally secreted by our brain, that's called pineal gland. And if you put your room in darkness, it automatically comes.
Right.
And the melatonin sleep again is not comparable to normal sleep. So one must not
Should stay away from this, right?
Yeah.
All right, we'll very quickly have a quick rapid fire round. I'll request both of you to give us very brief answers for our viewers to get some myths cleared. Napping can make up for lack of sleep at night. Dr. Madan, is it so?
No, there's nothing which can take substitute a good night's sleep at night.
Dr. Khilnani, you can catch up on lost sleep by sleeping on weekends.
No, that's not true. Everyday sleep is very important.
Drinking warm milk will help you fall asleep better, Dr. Madan.
I think this can help, but I think you avoid a very heavy meal or heavy, right before sleeping.
Insomnia is primarily a psychological issue, Dr. Khilnani.
No, it's not necessarily a psychological issue. Psychology adds to it.
Eventually, getting less sleep, your body gets used to getting less sleep eventually. Dr. Madan, is it so?
No, it's not so. If you have a body which has a minimum requirement of sleep, if you continuously sleep less, you will get sleep deprived. You will not get used to it.
All right. Also, good sleep is about the number of hours you sleep, Dr. Khilnani.
Yes, that is true. The number of hours are important, and also a sound sleep is also important.
All right. On that note, we'll end this discussion here. Thank you both of you for joining us this afternoon and helping us understand insomnia better. So, lack of sleep can have a plethora of negative consequences in your life. After a long and exhausting day, it is critical that you give your body the rest it requires and deserves. If you believe your sleep cycle is unstable, consult a doctor. Also, taking regular health screenings can help you get a comprehensive understanding of your overall health and take preventive measures if something comes amiss. After all, a good laugh and a good sleep are the two best cures for anything, isn't it? On that note, we'll end this edition here. Thanks for watching. Till we meet next, take good care of yourselves.